Okay, so now we're going to look at Chapter 9, some healthcare organizations and structures. Not really in depth, but at least some basic information for you to know. Again, I'm not going to read the learning outcomes. Again, I encourage you to follow along in your book. Your book has a lot of ancillary information that will help you understand this concept. So the learning outcomes, again, I'm not going to read those. But we look at organizations, we look at characteristics and types. Ownership influences how organizations are structured and can impact efficiency and quality. Types of services, this is going to be something like a specialty or a general type of service. So when we look at University Hospital, that is general. And if you look at Lindner Center of Hope, that would be a specialty. Length of direct care services, generally when we're talking about that, we're talking about either greater than 30 days or less than 30 days. Ownership, ownership being public or private. So some public ownership would be the VA, correctional facilities, some state hospitals, and then we'll look at private, nonprofit, and then for-profit hospitals. Teaching status. So when we think about teaching status, maybe you might think Christ, because all of the students from Christ College go over to Christ Hospital. But Christ is not typically referred to as a teaching hospital. A teaching hospital is something like University Hospital, where they have people there that are doing the jobs of other people, such as a resident would be performing the jobs of the doctor and things like that. And there's usually some monetary compensation that comes from the university to the hospital in order to make that happen. And the reason there is that compensation is because if you've got doctors having to teach other doctors, that does take more time. So that's why usually there is some compensation. Usually teaching hospitals are more expensive for them to run, but studies show that in long term they decrease readmissions and better post-acute care. They're usually larger, located in more urban and economically disadvantaged areas. And then your accreditation status. We know that all hospitals have to be accredited by some body. We just generally use the JCAHO accreditation. Not-for-profit versus for-profit. Ownership influences how organizations are structured and can impact efficiency and quality. Not-for-profit hospital organizations are controlled by a board or trustees, provide care to a mix of paying and non-paying patients, and excess revenue over expenses is redirected into the organization for maintenance and growth. So for-profit hospitals, get my clicker here. My advancing thing. Sorry about that. Operate with the specific intent of earning a profit by providing healthcare services to individuals who can afford to pay. And I don't know how you would categorize Lindner Center of Hope. I think the hospital portion is not for profit, but I'm wondering if the residential piece is for profit, because you have to pay for that residential piece, and usually it's payment up front that you have to pay before you can be accepted into that program. So I'm not for sure if that's the situation, but it's an example of a service that would be there for people that who can afford to pay. Usually insurances do not pay for residential treatment there at Lindner. So people literally have to come up with $60,000 in order to stay in their residential program. Other types of healthcare organizations, these are home healthcare organizations that try to keep people at home. Long-term care facilities where there is no skilled care given there. They are literally a place for people to be. Not that there can't be anything there, such as an IV or whatever. For the most part, we think of long-term care facilities as not skilled care. Hospice or palliative care services, and then nurse-owned nursing centers. Other organizations, community services, subacute facilities, home health organizations, again, long-term care and residential facilities, hospice, self-help, and peer assistance voluntary organizations. Supportive and ancillary organizations. Regulatory organizations. Typically, a hospital cannot bill Medicare unless they are accredited by some sort of body. And most hospitals do use JCAHO, but there are a couple of other ones that that can be there. There's the DNVGL, the Det Norsk Veritas, Germenscheider Lloyd, and so you might see that. We don't have any in the area, so just remember that CMS Medicare doesn't want to pay for an organization that's not accredited. Some integration that happens. Horizontal would be such that acute hospitals get together, and vertical, whole lines of services from acute to ambulatory and rehab and hospice are included under one umbrella. So vertical integration would be all of the subclinics that Christ has, things like that. As far as consolidations, that's something that happens. A perfect example of that would be the Jewish hospital that is near Kenwood, has been consolidated into or brought into the Mercy system. So that would be a perfect example of that. Acquisitions and mergers, obviously that sounds exactly what it is, where mergers come together and combine their assets and stuff to either form a new entity or again be part of a bigger entity. It's done for economic reasons, social reasons, and demographic factors. Demographic factors might be that, let's say, and Mercy at one time had this, now they no longer, but they had a long-term care facility that was associated with their hospital. So they found that they needed a place to send people after their hospital stay, and so that became Mercy St. Teresa, which again isn't in existence anymore. We look at theoretical perspectives. I'm not going to go over this specifically because you guys have already studied this in a couple of things, but the systems theory means what affects one part has some effect on another part, on another part, on another part. And then the chaos theory is that we're throwing things together not throwing actually, but putting things together and seeing what comes out at the end. Nursing role and function changes. As we have these acquisitions and mergers and stuff like that, there have been increased role in leadership and management. And sometimes they find that the most qualified people to be in those leadership and management positions are nurses. An increased awareness of need for a healthy work environment. Nurses are really the change agents when it comes to emphasizing the need for a healthy work environment, because we are the biggest number of healthcare workers that exist. So nurses are influencing policy and politics. So again, not a lot of information, just understanding, what's public, what's private, what's for profit, not for profit, how that works, understanding that a not-for-profit means that they don't make a profit, they just put their profit back into the organization. So awareness of the changing status of healthcare organizations and the ability to play a leading role in creating and evaluating adaptation in response to changing forces will be central functions of nurse leaders and managers in healthcare organizations. It's not a lot of content in that chapter, just some basics you'll want to know.